I really started to notice that the activity level that I once had was gone.
Quick step was the one that was most challenging for my hip and the most painful to do.
I usually tell patients when their bad days outnumber their good days and nothing's working, that's when you need to consider a joint replacement.
So one of the wonderful things about St. Thomas Joint Replacement Institute is that every patient is a name and not just a number and a procedure. We individualize the care for each patient.
We at St. Thomas Health want the patient experience to be amazing.
You really get a family experience with the people that work here. We are like a family.
People that are there with you, minute by minute, hour by hour, holding your hand or motivating you, stimulating you to be, to get up and do what you need to do. Those folks are just terrifically dedicated at the St. Thomas hospitals.
My goal is to restore pain-free function to the patient.
With the advancements in total joint replacement surgery, there's really no need to live with that pain.
The only complaint that I would have about all of my surgery is that I hadn't done it sooner. Here you go.
Stairs were almost a no-no. I couldn't pick up anything, more than 20 pounds. So it's just been a great big plus already. I can tell it's already going to be on the good side. I can feel it.
They want what's best for you, and it's just, I couldn't speak any higher. The reason I'm here today is because we just did my mother's knee yesterday, and she's 82 years old. So I kind of wish she had not waited so long because, it's really changed my life in terms of what I can do.
Usually we can get our patients up and walking, usually the same day of surgery.
We want the community to know that there's alternatives to being in pain.
I tell patients every day that a joint replacement's an investment for their future.
I've been a nurse here for 19 years and I've taken care of a lot of patients over the years, and it's just very rewarding seeing these patients before they come in for surgery and then seeing them get to go home and get a renewed life. They get a new lease on life.
Now I don't feel like I have any limitations.
St. Thomas Health has been doing joint replacement for a long time.
Dr. Ben Fowler traveled around the world in the late 1960s learning how to do joint replacements, and then came back here to Nashville and performed the first joint replacement surgery in Middle Tennessee in early 1969.
Joint replacement has become the elite. It has become the standard, the highest expectations.
Joint replacement is done in this day and age over 95% of the time for osteoarthritis, which is wearing down of the cartilage pad on the end of a bone or a joint.
The initial indicators of arthritis can be two things basically, and that's pain and swelling. Generally, pain is the first indicator of an arthritic joint, and you can have different flavors of that pain. You can have more of a chronic-y sort of ache, or you can have acute pain.
That arthritis can be brought about just from general wear and tear, or it could be from an old injury you had earlier in life.
In every joint you've got the hard bony surface, and on the end of the bone you've got a 1/4 inch thick rubber-like coating called articular cartilage. And osteoarthritis is simply where that wears down. Can be related to injury, can be related to genetics, can be related to obesity. A combination of factors basically causes a joint to wear out, just like a brake pad in your car would wear out over time.
In our joint replacement program, we have a very standardized approach that allows nurses and physical therapists and everybody that's involved to get really good at what they do, and that way we can pay much more attention to the patient and their experience.
We have developed over the past decade a very experienced process at all the St. Thomas institutions so that the patients have a seamless experience from their initial encounter for the scheduling of the surgery all the way through discharge and post-discharge.
We kind of brought the walls down between the different departments, between nursing and therapy and the doctors, and we just said, let's put the patient in the middle, let's figure out what the patient needs and how to get that done. And we just continue to work on that on a daily basis.
St. Thomas Health has been rated #1 for joint replacement, not only because of our volume that we do a a large amount of joints, but mostly because of the patient experience.
So at St. Thomas Joint Replacement Institute, we have individualized staff that just specialize in joint replacement. So they've received special training, special care, so that you're not going to get a nurse who's never seen a knee replacement or a hip replacement before. Those nurses specialize in taking care of patients with those problems.
People are what's so big about the program. From the nurses to the ancillary staff to the surgeons, we are a different breed of people. We are happy, positive, engaged people who desire excellence.
The spirit of this ministry is amazing, and it attracts a certain type of person, and then we nurture that spirit as they are employees for long periods of time. So I don't think anybody can replicate that anywhere in the world.
The physician engagement is amazing. They are so committed to this team and this program and their patients. They put hours and hours meeting, talking. If we need something, they're there to support us. If the patient needs something, they're there for the patient.
One of the things that's unique to our program is we have a very collaborative team approach. So after the surgery is scheduled, we have a specific medical evaluation and clearance by a preoperative medicine clinic that is expert at diagnosing medical conditions and clearing patients for surgery.
We identify any medical problems that may influence the outcome of the surgery. During the preoperative medical evaluation, patients will have many questions. We explain to them we're identifying all the issues we think that could impact their outcome during their stay at St. Thomas.
There's no surprises with this program. People come in very well educated, which is half the battle.
We offer a joint replacement class for our patients coming in for surgery, and basically it helps prepare them. There's so many questions and so many concerns with having this type of surgery, so our goal is for patients to come here, feel better about this, be prepared so there's no surprises.
In that class, they get taught what to expect from the day that they see the physician to the day that they get to the hospital to the day that they go home and after they go home.
I think the most important part of the class is just that personal touch. Being able to be here face to face with someone, ask questions, and just really be prepared and have someone talk to you.
So somebody that's motivated and educated in the process their outcome is going to be more predictable than somebody that just kind of sits back and just lets the process happen.
Education is a vital part of any process, especially an elective surgery like total joint replacement surgery. Right now, St. Thomas Health is doing several community seminars to educate the public on what joint pain may be coming from, what the treatments are that are available for joint pain, and ultimately we let everybody know about joint replacement surgery and what St. Thomas Joint Replacement Institute has to offer.
It's a participatory process in which folks come and they can talk to their other people in the community about what they're going through. You can ask the surgeon in a very casual manner, or the therapist or the nurses that are there, what arthritis is all about and what your options are. And you can also learn a great deal, as we did tonight, through other folks' questions.
What we want to do is reassure them that there's physical therapy that we always try first to see if that helps you. And then don't be afraid of surgery. We don't want you to be afraid of surgery. Now we've gotten to be such experts at it, and we feel so good about it that we want you to feel comfortable coming to us and letting us take care of you.
When you're going to have knee surgery, you've got to get yourself mentally and physically ready. I've always been a very active person. There's really nothing that I wouldn't try to do. I bowled for probably 40, 50 years, and then I played softball, played basketball, and most of all, I played with my grandchildren. I really started to notice that the activity level that I once had was gone. Going up and down the stairs really bothered me. I'd have to put the good knee up and let the bad knee follow. One day I just kept thinking, you know, why am I putting myself through this? Why don't you get your quality of life back? Dr. Smith has your interest at heart. I told him, I said, I want a knee, I'm real active. I want a knee that I can still be active with. And I said, well, I tell you what, if I decide to do this, I'm gonna pray that my knee surgery is the best one you've ever done. I mean, as you can tell by looking at it, I can tell not only by looking, but by the way I use my knee, that he couldn't have done a better job. He was very compassionate. He took time with me and explained everything. And so after talking with him, when I left, I felt very comfortable. With St. Thomas, everybody was fantastic, from the doctors to the care that I received to the nurses that were there. I mean, they were on top of everything. If you'll do what your doctor tells you to do, what the staff at St. Thomas tells you to do, then you're going to have a good experience. And if you work your knee's going to work good for you. You can see it just works super. Woo! If I had another knee, I'd do it all over again.
If a patient's having pain, and especially with a knee joint pain and swelling, it's time to at least get an evaluation by a specialist, which is an orthopedic surgeon.
As physicians, we always try to manage patients non-surgically as long as we can. That's pretty much always in the best interest of the patient. So when we see patients initially, we try with physical therapy, with medications. We have a number of injections of medicines that are very successful.
Surgery, while it's a great alternative, is when conservative treatment fails.
When I'm trying to decide with the patient if they need a joint replacement, really the most important thing is that their quality of life is suffering because of the hip or knee arthritis. Patients don't want to have to accept a diminished lifestyle, and when the arthritis is preventing them from doing the things they love, whether it's golf or ballroom dancing or hiking, when they are severely limited because of the arthritis, we want to get those patients back to doing the things they love, and oftentimes that requires a joint replacement to get them there.
Hip replacement was the first joint replacement that was invented, and that was done in 1963. In a hip replacement, once you recover from it, it's like you almost don't know it's there. A knee replacement is a little bit more difficult in the initial postoperative period, and the reason is we're taking a knee and doing a surgery on it, and then we have to make you do physical therapy afterwards to work on bending that knee so the knee doesn't set up with scar tissue and cause it to get permanently stiff.
We are special. We are the elite. We treat the patients differently. They come in, they go to a specific area where they see joint replacement staff. They see the same staff before surgery and after surgery. We just want them to be a part of the family.
Most surgeries last an hour, maybe an hour and a half these days. And then recovery rooms is maybe about 2 hours, and then they're back up to the floor and they start therapy right away.
So we get our patients up from surgery, and we lead the national standards. We actually get our patients up the day of surgery. And it's pretty amazing to us and to them to see them. Before surgery, they're hurting, they're uncomfortable. They get up the day of surgery, things that they haven't been able to do for years, they're able to do even right after surgery.
Immediately after my surgery, or I say immediately, within an hour, they had me up and walking already. And I walked around my room with a therapist, and it was just no pain. It was fine.
The benefit to the patients of working in an environment where there's high volume care are manyfold. There's a lot of very good information to show that if you go to a surgeon or an environment that is a high volume joint replacement type of environment, the outcomes are superior, the complications are lower, so the quality of the outcome of the product is much better and much more uniform.
We do a lot of work with customized implants and customized cutting jigs, which is pretty revolutionary. You can scan a patient's bone now and actually have an implant that's built specifically for that patient, so it's individualized treatment and individualized implant options that are designed specifically for that patient, so the patient gets a device or an implant that has been made based off the shape and size of their existing bone, so it's a perfect match.
For probably the last 15 years, my focus has been on what is considered minimally invasive or muscle-sparing type of surgical procedures. I've always been interested in looking at newer and leading technologies when it comes to making the patient get better faster.
One focus of study and focus of my surgical regimen has been partial knee replacements. Partial knee replacements are just that. They're the exact same concept as a full knee replacement, but it's only part of it. And it's always better to do as little surgery as you can and still fix the problem. Partial knee replacements are for those folks that have arthritis that is truly confined to one area of their knee. There's 3 areas of the knee, the medial or inner side, the lateral or outer side, and then up under the kneecap. And if you have a pattern where you have arthritis isolated to one specific area of the knee, you can resurface just that side, and there's advantage to that.
It takes a village to make that joint replacement successful afterwards.
We really want patients who are going to be motivated, who are going to have a positive attitude from the start, and that want to get better, because that really does help their outcomes. If patients are enthusiastic about getting through the therapy, they tend to get through the whole process a lot faster. There's a lot of great support staff here in terms of nursing staff and physical therapist staff, but we do need an active participant from the patient themselves.
We have created a team here at St. Thomas Health, and the patient is part of that team. They are the captain of the team, in fact. They're the most important player on that team, and we need them to be an active participant in the process.
You want patients that know exactly what's going on. You want them to participate in the process.
You're going to kind of get out of it what you put into it.
What makes me happy as a surgeon is when the patient does well. And so more than anything, we want a good result for the patient, meaning that their pain is decreased, their function is improved, and their quality of life is dramatically improved.
I've built a garden, I've gone on hikes, I now do water aerobics and yoga. It's just, I just have a whole new lift on life.
Once patients leave the hospital, we do follow up with all of our patients, but we want you to know that you're still a part of our program, and that we're still thinking about you, and that we want to check up with you long term and make sure that our process went well here, that things went well for you at home, and that you're progressing as you're supposed to after your joint replacement surgery.
Beautiful music starts playing. It's like everything else disappears, and it's a magical moment.
I love the feeling of dancing. I've always enjoyed dancing.
Actually, it started maybe 10 years ago. I would notice if I'd go for long walks, it'd start to hurt a little, and I thought, oh, it's just getting old, and then it slowly got worse. And then maybe about 4 years ago, we were actually in Atlanta having a coaching lesson, and I remember very vividly, we were done with a step, and I was walking away, and both her and the coach said, "Why are you limping?" And I said, "I'm not limping," you know, and I denied it. And that's when I realized that this isn't good. But it got bad enough so that 2 years ago, I ended up having to start taking strong narcotics 2 or 3 nights a week just to get to sleep. The pain would be so bad.
It was hard to see him going through all the pain and the different measures he was taking to cope with that pain. The ice packs every time we would practice, and then at night seeing him have to take some medicine so he could sleep.
Bob Practico was an outstanding patient. He had a very positive attitude from the start. He was a very competitive ballroom dancer, and he was a very good ballroom dancer before his hip replacement.
But I made it clear to him that I was going to be his poster boy for this surgery. And I think he laughed, and I also told him this was his chance for glory.
My job was just getting rid of his hip arthritis, so we got rid of his pain, and he was able to get back to the same level of ballroom dancing as he was before.
They moved me up to my room, and my first words were, my wife was there, and I kept telling her and the nurse, I want to walk, I want to walk. No, you can't walk until the physical therapist gets down here. And I badgered them so much, finally 3 hours after surgery, the physical therapist comes in, and so I said, I want to walk, and she goes, okay, before we try it, I want to see how far you can move your leg to the left. And so she was standing there on my left, and I just promptly moved it and kicked her with it. Her mouth opened, and she said, I've never seen anyone move their leg that far.
We're so fortunate, so blessed that he's come through it so well, and everything's good, and we can keep dancing.
People, they'll see me dance, and then when they hear that I've just had a hip replacement 3 months ago to this day, and they're incredulous. No one can believe it. So I have a hard time believing it.
You know, I wish I could bottle up a little bit of Bob Pratko and everybody and give it to all my patients because he had a very great attitude.
In our pre-op class, which is about 2 weeks prior to the patient's surgery, we give them a parking pass to park in the Mid-State Medical Parking Garage, which opens up to our unit right here on the 8th floor. What we've done at the St. Thomas Joint Replacement Institute is we have created our own little hospital inside of the hospital for our total joint replacement patients. And our first stop is admitting. This is the desk that the patients report into the day of surgery. It's just a few short steps from the elevator. They check in here with one of our staff members. We verify all of their information. They get a room assignment, and then we take them directly into the room that they're going to stay in while they're here with us at St. Thomas Joint Replacement Institute. This is one of our patient rooms. We do have all private rooms here at the Joint Replacement Institute, which have capacity for at least one family member to spend the night with their loved one while they're here with us.
Our ultimate goal is that the patient come in, they don't feel like they're in a hospital, they don't feel like they've been in an institution. They are actually in an environment, in a healing, faith-based environment, so that they know they have gotten the very best care that they can get. We want them to come in with a need from us, and we want them to leave with that we have fulfilled their need. We have met their needs and their expectations.
We thank you, God, that you have been with the surgeons, that you provided good care through them. And now as Brian goes home, we ask God that you'll be with him, that his recovery will be complete, and that he'll enjoy this new hip and get on with his life. And we give you thanks and praise. In Christ's name, amen.
A unique element to St. Thomas Health Joint Replacement is that we have a faith-based integral program that involves our pastoral care team. We really want to meet the patient's spiritual needs. And if that means sitting with them, holding their hand, we always have, besides the staff involved, we always have a pastoral care department that is available to meet with them, meet their needs, pray with them, whatever it is they need, we want to provide.
We have been planning with our physicians and other clinicians that make up the St. Thomas Joint Replacement Institute to build out this space, which will encompass the entire 8th floor on the Midtown campus. This is an exciting day. St. Thomas is committed to continue to improve the patient experience. We're committed to continuing to improve the health of folks in the Middle Tennessee and the region beyond. We have folks from Middle Tennessee that come to us in need of joint replacement. Our physicians and clinicians, in addition to our facilities, make the experience excellent. And that is our promise and commitment to this community. I want to thank everyone for being here. I want to thank our physicians for being part of this project, and together we're going to make it a huge success.
Over the past decade, if you look at the Middle Tennessee market, the St. Thomas facilities far and away are and have been the leaders in volume in joint replacement. And we're just looking in an evolutionary way to take that from an excellent program to the absolute best program, on par with anything, anywhere in the United States of America.
So I've chosen St. Thomas for a number of reasons. First of all, they've been one of the leading hospitals in the area for joint replacement surgery historically for probably forever. And they have really decided to increase the focus and get even better at what they've already done a great job at. And this is going to be evident in two ways. First of all, it's always been about the patient's focus. So they're patient focused, and the plan is to have a place where the patients are going to get very high quality, very predictable, good care, which has always been the focus of St. Thomas. And then secondly, for the physicians, St. Thomas has really put into play an environment where the physicians are going to really participate in a much bigger and better way.
The St. Thomas Joint Replacement Institute, it really is an institute. From the nursing staff to the physical therapist to the physicians, we all specialize in one thing, which is doing a good hip and knee replacement and shoulder replacements.
Got very well trained, up to speed surgeons because every patient is a little bit unique.
The teams are dedicated. You will see the same faces wherever you go, same smiling faces, same happy people. We're glad to be here and we love what we do.
We're truly like a family, and we get along like a family, and we laugh together, we cry together, and we make people better together.